Hi there, my name's Ruth Francis. I work at East Sussex Careers Hub at the County Council. Today we're going to find out a bit about a particular specialism in the NHS. So we're joined by Cassiano. Hi Cass.
Good morning.
Thanks for joining us. We are going to hear a little bit about your job. So I wonder if you could start by telling us your job title and what that involves.
My job is being an intensivist, which means a doctor who works in intensive care, looking after probably the sickest patients in the hospital. And we look at patients, other patients, for myself, from all variety, including surgical, medical, hematological, or any kinds of patients who actually require to come to intensive care.
Wonderful, thank you. And I understand you've got some slides which you kindly prepared for us, just taking us through your career journey. So if you'd like to start those, that would be brilliant.
Yes, I thought I'd put some slides together to show you what we do. Oops, hang on. I hope you can see that.
Yeah, that looks good.
Okay, and so this is how I become an intensivist. So as you can see, here
you are looking very adorable.
The pumpkins. I run a little, a small holding farm, so I have quite a lot of animals to play with initially. That's the picture of the place where I grew up, and that's where I went to the medical school. And you will wonder why I went to medical school. Well, it's difficult to know. I don't think I know myself. It's I made that decision when I was about 17 years old, so very close to the time to go to the university. And the main reason was I think I like it. I really want to be not an intensivist because I didn't know what it was at the time, but I thought I would really want to look after people. And maybe the background was a little bit about growing up in the farm, and my father was quite good to looking after animals who were sick. I always thought I really didn't want to be a veterinary, but I really want to look after people, and probably that's the reason I decided to go to the university. I went to the medical school. From there, I went to the first hospital after I finished my career, and I worked 3 years in this hospital. I did a lot of medicine and oncology there. And after that, I realized you couldn't survive in medicine without speaking English or understand English. So I thought I'd come and learn some English for 6 months. So I landed in the Royal Sussex County, believe it or not. And stayed there for 6 months.
That's in Brighton, for anyone who doesn't know, obviously. So just to interrupt there, Cassiano. So were you, your first hospital, after you'd finished, was that in Spain or Portugal?
It was in Spain, yes.
In Spain, okay.
A place called Vigo in the northwest of Spain.
Okay.
And as I say, after that, the requirements for medicine, I think it was important to learn English and to know and speak English or understand English at least. So I came to England and I landed in the Royal Sussex County. I did an attachment in there for 6 months. And after that, I applied for a job and traveled to Lancashire. And Burnley, for those who don't know where it is, it's up in the northwest, and spent there 1 year, the first year. But after that, I came back straight home to the Royal Sussex County and did a King's College rotation in anesthesia initially and intensive care after. And finally, I ended in the Royal Sussex County again in the last 15 years, where I practiced intensive care mainly and a little bit of anesthesia. So what is intensive care? So this is my trip, obviously, from my hometown in Spain up to London. And this is what intensive care is all about. It's a very special bed in the hospital where it's surrounded by quite a lot of machinery and a lot of pumps and ventilators and other kind of machines, which we'll go through very soon. So it's a very high tech. For those who like to play with apps, this is a very interesting app. There's a lot of apps, and the information comes to you through a monitor, which most of the things you can see or whatever happened to the patient. You can do that from home nowadays. But I guess in the near future, it will be much easier and much accessible for you to look after in such a way. And that's a good sample is medicine starts at home. If you do things properly and you can control yourself and maybe visit the hospital or the doctor very few times because you look after yourself, you will never end in this situation where
so very technology is going to empower the patients to look after their health from home.
Absolutely. I think it will help. And the way we're going, I think every single person will be in charge of their own health somehow. Mm-hmm. Obviously, still will, things do happen, infections occur and trauma do happen, but it's, I think it's probably less likely somehow. And the only time we see young people, I know young people will look at this video and say, this is not going to affect me. Well, I'm afraid it does affect you. And we do have teenagers sometimes in intensive care because trauma, infections, cancer, any other pathologies. And so it can actually affect everybody and definitely will affect some member of your family at one particular time. It is a very specialized bed. It's a very expensive bed. It costs over £2,000 a day to run it. It's got doctors and nurses all the time, 24 hours non-stop. And we're just gonna very fast go through all this. This is what it looks like most of the times, a very sick patient in the bed with a lot of machines. And you can see here a lot of pumps infusing drugs and fluids and food and anything else. And this is the ventilator. This is the kidney machine because the kidneys have to store. Sometimes we have another machine which pumps blood around the body. So to support the organs and support the body until the body actually recovers itself. So we treated the infection to stop the infection to go on and to give time for the patient to recover. So we don't really make miracles, but we do try to make the body sort of do it himself.
So Cass, just sorry to interrupt, with the patients who are coming in, obviously, as you're saying, they're the most seriously ill patients in the hospital when they come into intensive care. Are there particular illnesses or diseases that you see that are particularly common that you see?
Yeah, the most common ones we see is infections, followed by trauma and surgery.
Okay.
But infections, I think, is definitely number one. And very recently, as you probably can imagine, a lot of COVID patients have come with pneumonias, which is an infection on the lungs, affected by the lungs. They are very short of breath. They are very dependent on oxygen and some machines we use to keep them going. And some of them we ventilate them. So they were on the ventilator of the breathing machine for up to 60 days.
Okay.
It's a very long time.
Sorry, just one other question about COVID, because I imagine it's really changed your job in recent weeks. Yeah, just when someone has got COVID, how many weeks do they typically spend with you in intensive care?
Those who need to come to intensive care, they stay there a minimum of 2 weeks.
Okay.
But up to 3 months.
Okay.
So some of them, they have a very long stay and they have been on different machines, and they even have been put in a bypass time machine where we take the blood out and put it back again for a few days. And after that, when they start recovering, we put them back on the ventilator. So one particular patient had a very long process. She has done very well. She has gone home, which is very good. So obviously to monitor these patients, to have the high-tech information you require, you need quite a lot of this technology, which is our plastic catheters, which you have to insert. Most of them, like these ones, are to infuse drugs and to give fluids to patients. All of these are to measure blood pressure, continuous blood pressure, so we don't have to put a cuff around the arm. It's just, it does it every second. This one is to measure your cardiac output, so how much, how well your heart is working and how much is pumping out. And this one does very similar stuff, all of them very similar. So as I told you, this high tech and requires quite a lot of information, and this is what we get. This is your ECG. This is saturation, which is how much oxygen is in your blood. At the same time, you use your blood pressure every second, and this is your pressure inside your heart, and this is just your CO2, which is what the air you exhale when you breathe in and out. So we have a very good monitor. But you think it has a lot of information, that's not enough, because in the next door we have another screen which shows all the pressure from the ventilator, how much oxygen you require, or the pressure you need to inflate your lungs, etc., etc. If you start, it's not enough. We have another one next door. Which
I was feeling like I was feeling quite happy because I saw that first screen. I was like, oh, I think I know what all those things are. And then when you got onto the second screen, I was like, oh no.
And this is just to measure your cardiac output, so the flow coming out of your heart and the saturation at the same time. So we got quite a lot of information, and that's the reason we need all these catheters to be inserted. And just very fast, this is a ventilator which takes over your lungs and try to ventilate and give you the best oxygenation possible. It's all about. And this is just a small one, it's a portable one, so we can actually take the patients to the CT scan or the MRI. The next one is, obviously, you can remember every single doctor have a stethoscope. This is all technology. What we like to see is this one, which actually you can see in the lungs, and you can see in the heart, and you can see in the liver, and you can see a little bit more. Or even this one is even better, because that actually give you a lot more information. And that's the ultrasound machine, which again we use quite a lot every day. And this is when your kidneys fail. We have to put these long catheters inside your veins, very near the heart, and we take the blood in and out and pass it through a filter and take all the poison of your blood out to put the ring, insert it back again, clean, and that's how you take it on. And sometimes you have to do it for months, weeks, definitely days. Sometimes for weeks, and sometimes, unfortunately, forever. Very small amount per anyway. And that's an ultrasound machine, but very specialized with a special probe, which looks into the heart. And these are images of the heart, which always look all very strange and abstract for you, but I'm telling you, that's a lot of information. And that's very good information we can receive all the time. If you're always very unwell and you have, for example, a heart attack and you need some help, we put this long line inside the aorta, which is your main artery coming out of your heart. So this is your heart in here, this is your artery. Put this balloon inside and inflates, so we increase the pressure of your blood and to perfuse the organs and to keep you time to recover. And this is exactly the same, but it's a little bit more sophisticated. This is an ECMO machine, which is an extracorporeal membrane oxygenator, which means that we take the blood out from the veins, we put it through this pump, oxygenate it, and put the vacuum pressure inside your arteries, so you don't need your hearts and lungs for a little while until you recover and things go and do better. And these are long catheters. They go from your leg. This is your groin area, so it goes from there and goes all the way very near your heart. And you've got two of them, so once you put the blood in, the other one you take the blood out. And this is, you say, well, this is obviously too high tech, it's too much, it's too intense, it's too sad, because obviously all these patients are too sick. But I can tell you, when I start to have a mortality in intensive care of about 30%, we are now 30 years later, half of that, so 15%. So hopefully in the next 30 years.
That's really interesting. I did want to know about that, because I did think when I started, I don't know too much about your specialty, so I was looking at it on the NHS Careers website, and that was the first thing that occurred to me. Is this a really sad occupation because you are working with the most seriously ill?
No, the opposite. It's a very satisfying speciality, because you go home every day and you fulfill yourself. You have seen people doing very well, most of the people doing very well. Of course, we will have the sad times and the difficult times, and when we fail to turn things around. But you know, we start on 30%, and we are on 15%, but we hope in 30 years we'll be less than 7%.
Yeah. Wonderful.
So what other things we do? We're not just sitting there and being a saddos, working with so intense day and night. This is a 24-hour job. Therefore, we do other things at the same time to break away from that. And some of us, we do anesthesia, some of us do internal medicine, renal medicine, or respiratory medicine. So we do have other specialties. You don't have to, but you can. And those who may not have another specialty, I personally am very involved in education, and so we do look after doctors from the time they arrive from the medical school to the time they leave specialty, not just in intensive care, but surgery, medicine. So we do look after them. We do go to the medical school, and we're involved in general in medical education. And some other of my colleagues, they are very involved in management, and they spend a lot of time doing management for the hospital. And the new generation, they all obviously IT gurus, you like your artificial intelligence. This is the future, there is no doubt about. I think that is a very big field to expand in intensive care, which I think it would be really useful. Yes. And obviously, I'm an old boy already, and this is I'm growing up with the evolution of the high tech, and it's interesting how much it changed. But somehow I think we are very behind Google and Apple, and that's where we need to speed up, and that's where we need the newcomers, which they obviously are very exciting about playing with apps and doing new apps and doing new software. That I think that's what we need to be develop. And the only thing you can develop is you actually understand, sorry, you actually understand what the patients need. Trying to make somebody understand and create a software when they actually don't work inside is much more difficult. And probably not as good.
Thank you very much, Cass. That's really great.
Just two words to finish. I think it's very important to believe in yourselves. I think everybody can do whatever they dream about. You just have to make your dream to become true. You have to put your effort. There is no doubt about it. Nothing comes for nothing. And I'm not a cyclist, but I managed to go as high as 1,700 meters. So you can do it, even if it takes a little bit of effort and you have to sweat on the way.
Wonderful, thank you so much. I just have a few little extra questions, if you've got time. Yeah. So yeah, you've talked in detail about the technology involved in your role and the growing success that that has given the profession in people's recovery rates, which is that's so great to hear. Just looking back over your career, I'm just wondering whether you've got any moments that you're particularly proud of that you'd like to share with us.
Yeah, I'm sure. I think one of the beauty about having a career you really enjoy and you like is you have a lot of moments which are very special. Yeah, I would say the first one was interesting in such a how I think I was very proud when I achieved to have a training post in London at the time, in England. And so I thought that was a big step because when I came, I couldn't speak a single word of English. And 2.5 years later, I was managed to do a training post, and I thought was very specific.
Yeah.
And the second one probably when my first daughter was born. Definitely.
That's very nice, thank you. So yeah, well, we've seen your workplace, we've seen all the machines, we've heard about some of the challenges. So what would you sum up as being the skills and personal qualities that someone needs to succeed in intensive care?
I think you have to be caring, you have to be quite resilient a lot of times. Your communication skills have to be extremely good because information can be misinterpreted very easily. Families are in a very stressed moment, and it's very difficult to transmit the information you actually want sometimes. So communication is paramount in this speciality, and not just with the families and relatives and friends, but with other members of the team, with surgeons, with medicals, because we need them to have their input and their knowledge to turn these patients around. So we are very much a teamwork. We don't really work a single person there doing everything. We depend on our nurses, on the physiotherapists, on the dietitians, and all the other specialties. Everybody really have to have an input on this very, very sick patient.
Sure. Okay, that makes a lot of sense. So if someone's still at school or still in education, do you have any advice for them about the kinds of things they can do in their studies or outside their studies that are going to develop some of those qualities?
Obviously, science is important. It's not essential, but it's important to have a background on science. It helps you in your career, there is no doubt. But as I say, it's not essential. I know people who never really has done any science, A-level science, and they actually are very good doctors because it's not essential. But yeah, it will help. And the other thing I think is to do some special posts to go out to help people, to go to the nursing homes to see what these people, the old people actually require, the help they need. And that not just give you experience, but it give you a very good background how to deal with the situations otherwise completely unexpected, which you do not find in the normal life.
Lovely.
Yes, go out and do.
Yeah, go out and do. Yes, exactly. So thanks so much for your encouraging words to everyone who's watching. That's really nice. So
can I just say one thing?
Yeah,
I think is really important is the medical schools always like people who has actually thought outside the box and have gone and do something different, something not special or anything in particular, something really normal, but outside the box in the way of you have done something outside the career and you maybe being a captain of a team or organizing an event or anything. It does really counts, and the medical schools really like that entrepreneur ideas of people, because that's exactly what we need. As I was talking, we need the gurus for the IT, but we need the gurus for any other part of life, because the hospital is a very large entity which needs everybody.
Excellent. Thank you very much. So if you'd like to find out a little bit more about the careers available in intensive care medicine, you can go to the healthcareers.nhs.uk site and look at explore roles, and there you'll find under doctors intensive care medicine. And you were saying as well, Cass, weren't you, that on the ficm.ac.uk website, that's a sort of specialist one for intensive care. You'll find some careers pages there which will be really helpful. Thank you so much for sparing the time to talk to us. That's been great. And yes, and I'm still looking at that lovely view of your mother's from your mother's terrace out onto the that's in Spain, isn't it? In northern Spain.
That's in Spain, South Galicia, just in the north of Portugal. So actually the mountains you can see at the end is Portugal already.
Yeah.
Very near the border.
Thank you. Well, thanks so much for talking to us, and have a great rest of the day.
Thank you very much.
Thank you.